This lecture is part 2 of Introduction to the Oral Cavity for DEN 7125. So tooth surfaces. For every part of the tooth, there is a name and a place that we can reference to what we are going to identify, whether it be to a part of the anatomy where we want you to adjust your wax up, or where the location of cavities, or as we'll call them in dental terms, caries, will be. So going back to that midline here between the central incisors, the first part that we're going to learn is the mesial aspect of the tooth. The side of the teeth that are closest to the midline are the mesial surfaces. So here in the middle, we have these mesial surfaces. As we move to the lateral, this would be the mesial surface. And on the other side, this would be the mesial surface on the left. So all of the teeth, where they're facing the midline, that aspect of the tooth is called mesial. Now the opposite of that, what's facing away from the midline, that is called the distal surface. So the distal surface will be anything that's facing away from the midline, or you can also think of it as facing towards the back of the mouth, towards the throat. So that's mesial and distal. You can also see that the mesial surface of a tooth is usually touching the distal surface of the tooth preceding that one. And that's true for all of the teeth except for when we get to the center, because in the center here we have two mesial surfaces touching each other. So on 8 and 9, and on the lower mandibular arch, 24 and 25, will be the teeth, the only teeth where mesial surfaces touch together. Otherwise, as we move back from the central incisors, the mesial surfaces touch the distal surface of the tooth coming before it. Next, we'll look at the teeth from the outside view. So if you're looking straight at a patient, that's the part that we'll talk about next. So whether you're looking from the front or you're looking from the side, the facial surface is a collective term that we can use for both anterior and posterior teeth on the facial side. So it's like you're looking at their face, so that outside aspect is facial. Now we can go a little more detailed on the same view by calling the anterior teeth labial, because that part of the tooth is touching the lips. Or we can go to the buccal surface for the posterior teeth, because that part of the surface of the tooth is touching your cheek, which you will learn in dental anatomy or in your anatomy and physiology class, that is the buccinator, which is in your cheek. So that's called the buccal. Now if we look at the surfaces of the tooth, we have incisal edges or occlusal surfaces. So we say incisal usually when we're referring to the anterior teeth. And then for the posterior teeth, we'll call them the occlusal surface. So it's a little more like a table, like the occlusal table. And then the anterior teeth are more like an incisal edge. Rotating around to the inside now of the mouth, we have lingual or palatal. So the inside here This is a maxillary arch, so we can refer to these surfaces as the palatal surface because it's facing or touching the palate. And on the mandibular arch, we can call it lingual because it's facing or touching the tongue. So those are your main tooth surface names. We have mesial, distal, facial, which is also labial and buccal, or the lingual surface, which can also be palatal. And then if we're looking at the chewing surface of the teeth, we can call them occlusal, and for the anterior, we would call it the incisal. So here's a picture of an actual patient. They may not look ideal, but the same tooth surface names still apply. You would start out with the midline, and anything facing this line in the center will be mesial. Conversely, anything facing away from the midline is distal. And then the mesial surface of a posterior tooth will be touching the distal surface of the tooth preceding that. I do want to make the distinction that when you hear the word lingual, it may be referring to the inside surface of a mandibular tooth or a maxillary tooth, because your tongue technically can touch both upper and lower arches, if that's one way you want to think about it. However, when you hear palatal, normally it will be only referring to the maxillary teeth because that's where the palate is. On these pictures, you can also see occlusal for posterior teeth and incisal for anterior teeth. And then lastly, we have the facial surface, which is a collective term for the outside areas. But if you want to be more specific, you can refer to the posterior teeth as buccal and the anterior teeth as labial. Next up, we're going to be looking at landmarks, starting with cusps. Cusps are the points of the triangles we saw in part 1 for the functional tooth forms. We could have cusps on any aspect of the tooth surfaces that we just named, such as buccal cusps, lingual cusp, or mesial or distal buccal. So these are the various parts and terms that you will need to learn how to identify and memorize. So on this example of a premolar, here is a buccal cusp. You can also hear cusp tip. Now a cusp ridge is what comes down from that cusp or borders it. On the mesial and distal surfaces of the occlusal portion of the tooth, we have what are going to be called marginal ridges. On this image, we can also see a triangular and transverse ridge, with the triangular ridge of the buccal cusp descending from the cusp tip down towards the center of the occlusal surface. The slopes of each side of this ridge are inclined and resemble the two sides of a triangle. So that's how we get the name triangular ridge. As for transverse ridge, a transverse ridge is the aspect that crosses the center of the tooth. So it's transversing the tooth. And here it shows two triangular ridges meeting, from the buccal triangular ridge with the lingual triangular ridge. And then those ridges were descending from a buccal cusp tip and a lingual cusp tip. We have some close-up views of the incisal edges of some anterior teeth here, and you can see that the incisal edges are more broad here. Usually when teeth first erupt, whether it is permanent or primary teeth, you will see that they have these features called mamelons on them, and they're the little bumps that you see on these teeth. Over time, or with attrition, these bumps usually wear down so that the incisal ridges become more edge-like. Attrition in dentistry is what we refer to as wear over time, and it usually occurs due to usage and is more present as individuals get older. Continuing on with our landmarks, we're going to be talking about grooves and some other ridges. A primary groove is also known as a developmental groove, so you may hear these terms being used interchangeably. A primary groove separates the primary portions of the tooth, such as the cusps and the lobes, and you'll hear more about the lobes later on in this lecture. So on this image here, you can see the primary grooves. Here's the lingual because it's crossing over onto the lingual surface. Here's a buccal primary groove because it is crossing in close to the buccal surface. And then running across the center, we have a central developmental groove. For a secondary groove, we'll take this mesiobuccal triangular ridge as an example. Within this area, you can see smaller secondary grooves breaking up parts of the tooth. You will be creating these details and waxing them up as you work on your exercises in the lab. More examples of secondary grooves you can see here. Okay. So now if you will also notice on this tooth, it has triangular ridges and triangular ridges that cross the tooth as well. But instead of calling that a transverse ridge on a maxillary molar where they cross obliquely, we call this an oblique ridge. And this ridge connects the distobuccal cusp with the distal cusp arm of the mesiolingual cusp. This forms the oblique ridge. So I made a lot of colors on this tooth, but make sure you look at the tooth and be able to identify it and its features, and read the definitions as well. Now we have line angles. A line angle is where two surfaces join and come together. The line angle is named based on which surfaces are touching. This line is not going to be a hard or solid anatomical feature, but it's referring to an area. And there are rules for combining terms in tooth surfaces. So we start by naming the mesial or distal surface first. If it doesn't have either of these, we'll start with the next successive term and so on. So usually we start with mesial or distal, and then next we have buccal or lingual or labial, and then third we'll go to incisal or occlusal, depending on if you're on a anterior or a posterior tooth. They may vary, but those three steps are the same. So if you'll notice here, if we're going to be looking at the distal side of a tooth, and we're going to look at where it wraps around to the labial, this line here would be called the distolabial line angle. So if a line angle combines two surfaces, let's add one more for three surfaces and join them together. So instead of a line angle, we're now going to have a point angle. A point angle is where three surfaces meet and join together. Even though we're saying point angle, it doesn't necessarily mean that it is going to be a sharp point. It is just where the three surfaces join together. The naming convention for point angles is still the same for line angles as well. You will start with mesial or distal, and then you will go to buccal or lingual, and keep in mind facial is also an applicable term. Lastly, we have incisal or occlusal. You'll also notice that for any occlusal line or point angle, It is hyphenated from mesial or distal to lingual or buccal, and then hyphen occlusal point angle or hyphen occlusal line angle. So you can practice naming by identifying some corners in the room you're in and assigning surfaces. Where you will be hearing these used more is when we are going to be evaluating and critiquing your tooth wax-ups. And later on, when you're going to be drilling fillings of the teeth, we use a lot of line and point angles to help you orient how your preparations will be for fillings. So we may say something like your mesiolabial line angle is off or too distally oriented, or you might hear your distobuccal occlusal point angle is too short. So those are just a few examples. So let's just take one of these here and break it down. So again, let's look at a distal surface. So that's this whole surface here on a posterior tooth. And we want to identify, let's say, this point right there. So on a distal surface, we're going to wrap around to the buccal side, or you may also hear facial, but you wouldn't hear labial because you're back further on a posterior tooth. So if we are just talking about line angle, this would be distobuccal line angle. However, we're going to go up to the occlusal as our third point. So that's going to be distobuccal hyphen occlusal point angle. Now we're going to finally mention briefly the lobes that we mentioned earlier. Lobes are areas where the tooth form. All teeth have at least 4 lobes and sometimes even 5. You see on this anterior tooth here that there's only 3, but there's actually a 4th lobe on the lingual side called the cingulum, which you will hear more about on your anterior tooth lecture. Primary or developmental grooves tend to separate lobes, like we said before. A board question in the past used to ask which teeth have 3 lobes. So the answer would be none of them, since teeth have at least 4. So that's pretty much it for the lobes. But looking at all these different pictures of the teeth, as you study and learn, you'll be able to identify each one of these. You'll be able to tell if you're looking at the left or right side, or if it is a maxillary or mandibular tooth. Let's take this one, for example. So this one is a maxillary right incisor. Some of its defining features are a sharper mesiolingual incisal point angle and a rounder distal facial line angle. And the number of this tooth is number 8, because we can tell when it's sharper here, that's the mesial. So again, you'll have more practice with these, especially as you start to learn and go into the tooth lectures that group them. The last terminology we will be discussing for this lecture are embrasures. Looking at the photo, please notice the mesiofacial line angle. So here is the middle. So everything facing the middle is mesial, and everything from the outside of the tooth is facial. So the line angle mesiofacial will be right here. Where these teeth come together, there is an interproximal area, and that forms a V shape. This is the embrasure. An embrasure is a V-shaped space emanating from a contact interproximally between teeth, and there are going to be 4 total between the contact point. So we have a facial embrasure, we have a lingual embrasure, and then if we go to another view of the tooth, this is the contact area, we have an incisal embrasure, or it can be known as an occlusal embrasure for posterior teeth. Lastly, we have a gingival embrasure here. The gingival embrasure that I just showed you is named for its location being closest to the gingiva, otherwise known as the gum tissues. In Part 3, Dr. Nelson will be giving you an overview of the intraoral and clinical anatomy. Once again, please be sure to read the textbook so that you can gain an even more thorough understanding on the terms that we're presenting to you. Your exams are going to be based off of both the lectures and the book. Thank you so much for your attention, and feel free to send us any questions you may have. We're looking forward to meeting you in class.